get into sort of the meat, I guess, of the talk today, which is talking about kind of the research paper. Call it a brief anatomy lesson. This is a lovely painting by Rembrandt. Probably heard of Rembrandt. And this is a physician from, I don't know, the 17th century, I guess, or 16th century, who's instructing these other doctors. And apparently they had to pay this doctor or pay Rembrandt so that they could appear in the painting. But they're learning the anatomy, obviously, of the arm here. I love this painting. It's really kind of real-time, beautiful. This is when Rembrandt was younger, just starting to get established in his career. And one of the first times, and supposedly somewhere here, but I don't see it, maybe here, one of the first times he actually signed using his full name, which meant that he was finally feeling confident as an artist to put his actual full name on there rather than just initials on the painting. So, all right. So as I said, for those of you who have not written a paper, maybe this part will be most useful for you as you think about kind of the anatomy of a research paper. And you really just stick with a formula. You just have to, I remember the first paper I wrote with a mentor of mine, the first research paper. And it's like, here's this piece, it should be about this long. Here's this piece. And so you have an introduction, which should say, why did we do the work? That's the question. The methods, how did we do the work? The results, what we found, and the discussion, what does it all mean? And I was just having a discussion with one of the professors here about this piece is sometimes the hardest, really, and the one that journal editors really look at. So they're like, okay, I see why you did it, and how you did it, and what you found, but why should we care? Why should the world hear about this? And you have to be able to answer that question, or you're not going to get your paper published. Hopefully you have kind of an idea of that before you go into doing the research, because that's why you did the work. And again, block out time to write. And this is if you're a junior faculty member, so this is not relevant to 90% of you. But if you're a junior faculty member, you want to, this is a maybe American expression, to keep several pans in the fire, all with different cook times. That means that if you really want to have, if let's say your requirement for promotion for us is 20 to 25 papers at the end of 6 years, right? You can do the math. You need to publish more than one paper a year. Then you'd only have 6. You actually need to publish more than 2 papers a year on average. Okay, maybe more like 3 or 4. Now, you can't be first author on all of them, but it means you have to have different projects going on at different stages, because you can't have them all in the, I did the research, I've got my results, and now I need to write them up. You can't be writing up 6 papers at one time, as the faculty know. So you want to start projects and have them at different stages. But you'll worry about that later when you actually have a job as an assistant professor or as an instructor. So what part of the paper do you think is read most often? What do you think? I'm hearing abstract, yeah. So that's a good guess. And that, in many ways, that's right, but it's really the title, right? So that's the first thing people say when they're searching for the paper. They're going to see the title. So it turns out the title matters. I was talking to, I guess it was the dean yesterday, the dean of MUPH, who was saying he's now using ChatGPT to help him come up with an interesting, great title. I've never used it for that before, but it means that the message there is he's putting thought into the title. It's not just like, oh, I need a title. Oh, here's a good one. Send off the paper. It really does matter. So the title is actually the basis for most online computer searches. If your title is insufficient, that it doesn't really do a good job of explaining what the research is about, then people are just going to look at the title and go, doesn't look relevant, I'm moving on. Okay, so it needs to make sense. It should reflect the main focus of the paper. So they matter, so choose carefully. Okay? Some people are really good at them also. I sometimes find that I go to this one mentor, this 80-year-old mentor I have. He's great at titles. He can really just come up with some good ideas. Some people just have that knack. But next time I'm going to try ChatGPT, see if it works. So in picking a title, here's a couple of choices for you. So which title is better and why? And what are the strengths and weaknesses? Here's two that I just picked from the literature randomly. Okay, Association of change in cardiovascular risk factors with incident cardiac events, number one. Or two, physician empathy is not associated with laboratory outcomes in diabetes, a cross-sectional study. And I think each of these has strengths and weaknesses. So, but which one do you think overall? I know they're totally different topics, but they're different kinds of titles, and I'll tell you why in a moment. But who votes for number one being the better title? You have to vote for one. You can't abstain. So just one vote for number one. So the 3 votes, 4, 5, 6, 7, okay? So maybe a quarter of you. So number 2, most of you. And some of you aren't sure. And it's okay to not be sure. So I would say generally descriptive titles are better. So this one is descriptive. It's just saying this is what the research was about. The research, we looked at the association of change in cardiovascular risk factors with incident cardiac events. So that's just describing. This one's informative because it's telling you what they found in the title. And you might think that's good, but in fact, if you read the paper, you might say, I'm not so sure that you really proved your point here. You don't want the title potentially to be misleading. So here it says, is not associated with. Generally, as a journal editor, I don't want the title coming out. I want the reader to read the research, read the conclusion, discussion, and results, read the discussion, and make up their own mind. In the paper, they'll say, so we feel we found that physician empathy is not associated with laboratory outcomes. But I don't want them putting that in the title. That's not the headline. The headline is, association of physician empathy with laboratory outcomes in diabetes. That's what the title should have been, right? This is just an association. This is not a randomized trial. You can't really say this is the truth when you did a trial looking at an association, because there's so many potential confounders, right? So they're making a statement of fact when they should have just said, association of physician empathy with laboratory outcomes in diabetes, a cross-sectional study. That would have been a better title for this. Okay, it's a little bit subtle, but I hope you're getting the point. You want to stick with descriptive titles, not informative. But I like this one because it includes the methods in the title, and that's nice. There are some journals that kind of require you to do that. The BMJ is one. And I think that's really good because when you're doing a systematic review or a meta-analysis, you usually, let's say you're doing a meta-analysis, you want to include only randomized trials in your analysis. So you want to know right away, this is just a cross-sectional study. Looks interesting, but I'm not going to include it in what we're going to be including in our meta-analysis or our systematic review. So this doesn't include, we don't know what their methods were here necessarily. Okay? So here's some of my titles. You can tell me whether you think these are good or bad. This is one. So I sometimes like titles that are sort of like fun or kind of catchy. And I'll tell you, even from like if you're sending in an abstract, as someone who's reviewed abstracts from other professors who probably have done this, when you make get 10 abstracts that you're trying to review like in an hour, okay, it's really hard to read them really carefully. So I would say about a third of the likelihood of whether that abstract's going to be accepted or not is whether the title is really good. And it may be a different title than you use for the paper. You want it catchy, interesting. You want it to jump out, you know. So let's not talk about it, suicide inquiry in primary care. So we found that doctors don't like talking about this, nor do patients. So it's kind of a cute title. Okay, is it a good title? I don't know. Well, we don't have our methods here. It's not really a great title, but I kind of liked it. Here's another one I did with a fellow, psychiatric consultation at your fingertips. Again, kind of cute. So you can kind of get cute if you're using a title and sort of subtitle. And then this is a descriptive analysis of electronic consultation from primary care. This could have been the whole title, right? That's really what it is. But we added this because it kind of was a little catchy, kind of got your attention. What does this really mean? And then we kind of describe it here a little bit more. Here's one that I showed related to mentoring. This is probably the top medical education journal. It is the top medical education journal in the US, maybe in the world in terms of impact factor, for those of you who do med ed research. Really hard to get in here. And they want you to say your methods. So this is characteristics of successful and failed mentoring relationships, a qualitative study across 2 academic health centers. That's very straightforward title. Not very exciting, but you know exactly what this paper's about. Okay, and we don't tell you what we found. We just tell you what we studied. So here's one from my time in Kyoto, and actually, she's now back in Thailand. Some of you know her. She goes by Jar. She works for the WHO here in Bangkok for WHO working with the Thai government, trying to reduce traffic, trying to improve traffic safety, which, oh my gosh, when I see the traffic here, that's a really hard job. And there's so few people wearing, I understand you have helmet laws here, but nobody wears a helmet, or very few, maybe 50% adherence with helmet laws. So she has her work cut out for her. Hopefully you'll get to meet her someday here. But so she was a student there, as was Patu, who was from the Congo. And I was mentoring Patu and actually Jar on their PhD research. And I met criteria for authorship because I actually worked very closely with him to analyze the data. But look at this. This is a completely different kind of title, which is really okay for qualitative research if you're doing and this is really catchy. This is a quote from the study. If I have nothing to eat, I get angry and push the pills bottle away from me. A qualitative study of patient determinants of adherence to antiretroviral therapy in the Democratic Republic of Congo. And you know what he found here, as you can kind of tell from the title, is that patients were not taking their medication because they were told you can't take it on an empty stomach. And because they didn't have access to enough food, they weren't adhering to their medications. Really bad, right? Not a good outcome here. But this is a quote from the qualitative research that just summarized beautifully. And it's catchy. You see the title, you go, I want to read the paper. That looks really interesting. You can get away with that with qualitative research. Okay, so the second most read part, as you said, is the abstract. And that was a good guess. So the abstract allows other researchers to quickly scan the literature and decide what they want to read in more depth. Right, so I'm doing now a narrative review with 2 mentees. So they're looking at the title, looks interesting, printing out or downloading the abstract to take a closer look at it later. They're starting with the title. Do I even want to download this paper? And then, yes, I do want to download it, and now I'll take a look at the abstract to decide if it meets our criteria for inclusion in our review. It's probably the most read portion of your paper after the title, so you need to make it good. And what's hard about the abstract? It may also be the only part of your submission that an editor has time to read carefully. I will tell you that that's true, that as an editor, I've made almost 90% of my decisions about whether to send the paper to our deputy editors, whether to send it out for review or not, based on the abstract. Sometimes I would skim through the paper, but most of the decisions, a good portion of the decisions were made based on the abstract. So you really need to spend time on it. And why is it abstract so hard? Oh, I have more here. It's because it's short. I think I added a quote somewhere here. Maybe I didn't put it in. There's a famous American writer named Mark Twain. Have you heard of Mark Twain? He wrote like Huckleberry Finn. He's a marvelous writer, if you want to read kind of all classic American literature. But Mark Twain has many famous quotes. He would go on stage. He was kind of like a stand-up comedian in his day also. He has a quote about San Francisco, my town, where he said, the coldest winter I ever spent was a summer in San Francisco. Because we have a lot of fog in San Francisco in the summer. It makes it really cold. So that's a famous quote. The other thing he said was, if I had more time, he's talking about writing. If I had more time, I'd make it shorter. Okay. If I had more time, I'd make it shorter. It's harder to write shorter than to just put all these words out. An abstract set can only be, let's say 300 words, really hard to do. So you need to pick each word closely. The mistake people sometimes make with an abstract is they kind of do it at the beginning. Maybe you had an abstract for a meeting, and then you don't look at it again, and it turns out you've changed the paper, but you haven't updated the abstract. That's a real no-no. So you need to look at the abstract again when you're done to make sure it actually matches what's in your paper. And the abstract has the same content as the paper, right? The background, 1 or 2 sentences that set the stage for your research question, followed by a clear statement of the question or hypothesis. I'll show you an example in a second. And then the methods, then the results, and then the conclusions. And all of this in 250 or 300 words. Hard to do, particularly when English isn't your first language. It's even harder, right, to be pithy, to be short and direct and clear with fewer words. So this is where you can also use a lot of help editing, getting comments from other people. So here it is. So, whoops. So here's if I had more time, I would make it shorter. I love that. And and also remember when you're writing your paper, like it will say for each type of paper you're submitting, there'll be word limits, right? Let's say for a research paper that doesn't include that, for not qualitative research, they might say 2,500 words or something like that at different journals. And I want to remind you that those are word limits, not goals. Okay, you might write a much better paper that just has 1,800 words. Don't try to aim for 2,500 words if that's the maximum. I see papers coming in 2,499 words. Because somehow the author thought, I have to fill it up. It'll look better with more words. No, try to tell the story shorter. So much better if you can. Okay, this maybe most useful tip. I don't know. I know when I work with junior people, they have a really hard time with the introduction, and they tend to write introductions that are way too long. So it's okay to keep it short, unless you're writing in a social behavioral science journal, when they tend to be much longer. So if you're writing in like social science and medicine, if you write in those kinds of journals, they tend to be much more descriptive, long introduction. Usually medical or public health journals, I think, short, really short. So, and there are 4 components. And I think if you can keep this in mind, it'll help you write your introduction so much easier. One is, so here's the 4 components. What is the problem? What is already known? What is not known? Why and how did you do your study? That's all. What's the problem? And here it's simpler to do this in the context of a disease, sometimes a little harder if it's a public health or health services paper, but anything you're writing up can fall into this. So X is a bad disease with a poor prognosis. Okay, that's the problem. What's already known? Treatment A and B are known to be effective. What is not known is combining A and B beneficial. And then finally, we conducted a randomized clinical trial to determine whether A and B is better than either one alone. This is a simple example, but it always helps me still when I'm thinking about what's my first couple of sentences in the introduction. What's the problem? Colon cancer is a leading cause, it's a now leading cause of cancer death in Thailand. I'm making this up, I have no idea if it's true. But colon cancer is the leading cause of cancer death in Thailand. We know that screening for colon cancer can effectively reduce. So you have a few more words about colon cancer in Thailand. A few more sentences. We know that screening for colon cancer can effectively reduce death from colon cancer. We don't know how to more effectively engage patients to accept colon cancer screening. And so we did a study where we compared this method to that method of trying to educate patients about the importance of colon cancer screening in Thailand. Okay, something like that. Makes it so simple to write that introduction. So here's that one paper I showed you, where we did it. Mental and behavioral health problems are among the most common and costly conditions in the United States. What is known, blah, what is not known, and then why and how we did our study. We evaluated a consecutive series of the first 50 e-consults to describe the consult questions and responses, assess response time and implementation, determine the rate of, so boom, one sentence actually summarized our methods. I was going to have you practice, but since nobody's working on a paper, it's going to not be a good use of your time. But you might even think about doing this if you're even thinking about writing a paper or even engaging in research, I suppose. You can think about what's the problem, what's known, what's not known, what do I want to do to try to figure this out. Super helpful. I think it's super helpful. Hopefully it will be helpful for you. Questions about the introduction? So it's a part that I know when I was junior, I had a really hard time with it. And sometimes you go back and write that afterwards, or go back to it. That's true for the whole paper. Sometimes you have to look at your methods and results really carefully to realize, oh yeah, this is problem I was trying to solve. Shouldn't lose sight of that, but sometimes you can. Okay, methods. There should be enough information here for someone else to replicate your study. Or you can reference your prior study, right? If you collected a big data set and you're writing 5 papers from that, you don't want to describe your methods all over again every paper. You can very short and just say, see our prior publication. Oh, we're handing out paper, but I don't think I'm going to have you do it unless you want to do the exercise. Do you want to try writing something? Yes or no? No. I heard a very clear no here from the front. You can do this on your own. I mean, again, the only way you're going to get better at this is to practice. The point of that was to have you practice and then share. You can't have any pride when you're writing. You have to just put your pride aside and take the feedback and appreciate the feedback. So often diagrams, tables, or flowcharts are really helpful with methods rather than a lot of words. You don't want a lot of words in your method section if you can. And you do not want to put results in the method section. That's a huge red flag for editors. Except if you used, and I'll show you an example. If you got some results from like a pilot or something that helped inform the development of your bigger survey, you can include that because that's part of your development of your survey, right? So then you'll have results in your methods, but that's really unusual. So we developed a mentor assessment instrument, a paper that I published a few years ago. And in our methods, we we kind of pre-tested this at UCSF and the schools of medicine. We had N120, blah, blah, blah. We had some results. So because we kind of did this pre-test in the development of our methods, the final survey that we then tested, we could put the results in the methods. This is getting far too detailed for most of you probably. Maybe the main message I want you to remember is don't put results in your methods. It makes you look like you don't know what you're doing. I'll pause there. Coffee is cool enough now to sip it. Thank you. Questions about title, abstract? Yes, please. There is a mic here. Would you mind running it back? Thank you.
My name is Dr. Ravipan Vitinkanit from Ramatipiti Hospital. I would like to comment about the title.
Yeah.
Because I'm the old person. So in the past, our paper, usually the title were, I think, all descriptive. But nowadays, I found that more and more paper, the title are informative, which I don't like. I think descriptive is more, I think, more attractive and don't really tell people what we found until you have read our paper.
Yep,
But
I agree.
to be informative, I think, as you said, we don't know whether it's true or not. You already told them that what you found and what it is, what it means. So I think we have to leave to the reader, the people to decide whether our paper is true or not. Not just tell them straight away. I think it's not so attractive, I think.
Yeah, thank you. I completely agree with you. So thank you for the comment. It seems like really little stuff. Like, why are we even talking about titles? But it's important. It's part of the integrity also of the literature. I mean, when you're writing, you have an obligation to be as ethical as you can, to put your work out there with a lot of integrity and honesty. And I'm not saying people are dishonest when they use informative titles, but it's not as kind of straightforward and honest in a way as just a descriptive title. If you're trying to put an idea in the reader's head, you should let the reader decide. Any other comments?
Another
Yes.
thing,
Yeah. Please.
another thing is about what is the first part to write.
The first part? Yeah.
To
What do you
write,
think?
To write. I think personally, I would like to get the introduction done straight away because to start to write the paper, I think we have the concept already, why we do it.
Yeah.
So I think it's better to get it done straight away before we forget. Because I think it's fresh when we start to write and then followed by the material and methods.
Yeah.
Which is very easy. I think material method is the easiest.
Yeah.
But introduction, I think it's not so easy.
Yeah.
So I think we better get it done straight away and then write the method and material and then wait for the result.
Yeah. I mean, that's totally legitimate. And I think for you all who, you're still junior at this, you'll work with different mentors and different faculty, and they'll have different styles. And you'll have to just figure out what works for you. And I totally get that, and sometimes I do want to start at the beginning, and the introduction reminds you, like, why did I do this work? What's the problem here? Why does it matter? What did we find? What did we do? It kind of lays out. But it is true, I think, as you just said, that the methods and results are easier. And often it's hard to get started. So at least you kind of like, okay, I have something out. It's concrete, it's down. Now I've got the ball rolling. You like to do the hard stuff first, which I totally get. I'm kind of built that way also. But you'll all find your own. You'll all find your own. your own style. Please.
Yeah, thanks so much. Let me share. Um, according to my experience, the most easiest is to extract the table, 4 or 5 table of results, starting first. And then I jump to methodology, research method, because it's more easy compare with other parts. If you done accordingly to result and methodology, the method of study should be let everyone understand and it can be duplicated. Okay? Anyone can be replication for our study again. So everything should be clear. Even the tool, the instrument for data collection, how validity and reliability of it. Okay? Or even how sampling, sample size calculation, blah, blah, blah. Everything should be clear cut. Okay? After done accordingly to the two part, then we have our heart gonna be feel better because we still have the hard or the tough part. Introduction come after, but the most crucial point, most difficulty in my understanding is discussion. So I left it the last one. And then finally I did for the abstract after completely everything. But mostly many of the journal, they will ask us accordingly to such a new one, a new knowledge that been found in your study. Please written in 1, 2, 3 bullets, something like this, okay? Then we think about it after, okay? Let me share. Thanks so much.
Thank you very much. So you junior people, you see there's no right way, okay? These are two smart, experienced professors who approach it somewhat differently, and they're both successful. So and I maybe have a third way, and I work with a mentor when I was younger who had a fourth way. So you'll figure it out. I'd say the most common are the two what you've just heard. Get the tables out, maybe a little bit how different brains work. Get the tables out, look at that, you've got your results, write your methods, and go from there. Other approach, get that introduction down. It kind of, you kind of give yourself the beginning of the paper. It's a map of what you did, why you did it, and go from there. There's no right way. There's no right way. You'll figure it out as you go along.
Explain more about how to write down the gap and what is not known part. I think it's quite difficult. Thank you.
Interesting. So like in the introduction, what is known, what is not known. Well, are you working on any project now? We could use your project as an example.
About systematic review and meta-analysis about in community, how to improve MCI, mild cognitive impairment, elder adults cognitive function.
Okay. So what's the problem why are you doing the study?
In my paper, I write like this. In China, in hospital level, we have some traditional Chinese methods to prevent dementia in terms of mild cognitive impairment. But in community level, we still lack of healthcare system support. So it's still need to explore in community level how to prevent dementia for MCI elder person.
So does everybody heard that? Thank you. That's a wonderful. So MCI, mild cognitive impairment, is kind of the prior to dementia. And it more and more common with aging population and multimorbidity, things that may cause vascular disease, and who knows what's causing MCI. So you've got ways of treating MCI for people in the hospital, potentially, there's, the truth is, there is really no good way for us. Those of you who want to prevent your brain from getting old, stay young. That's not possible. So keep your body young, exercise, get enough sleep, reduce your stress, have good nutrition. All the drugs out there, unless there's some miracle in traditional Chinese medicine. We have a lot of drugs. None of them work very well. But anyway, that's just an aside. So I'm hearing the problem is that population is aging in China. MCI is becoming more and more of a prevalent issue. And there's there lack of recognition or lack of treatment out in the community, or maybe both. But you're doing a systematic review of, and I didn't catch the systematic review is of, tell me again.
The content is I want to find out what the existing studies how they promote the intervention about what kind of program they conducted in primary care setting in community.
In the community.
Yes, and I found that after the result, I found that the multi-domain interventions, such as just like Professor mentioned, including nutrition, physical activities, and the cognitive intervention and lifestyles modifications, combine them together to promote the cognitive function of MSI people.
So you found that that's what's being used, or that's what's been most helpful? Well, that's what's been most helpful. It's a multi-modality intervention there. Mm-hmm. So we know what the problem is the aging population and the increase in cognitive decline in MCI. And what is known is that we know sort of what interventions generally work. No, out in general, we know, like what I had said, nutrition. That's not new information. So what wasn't known? It sounds like what wasn't known is what's being used out there in primary care settings, or what's most effective in primary care settings in terms of treatment or prevention of MCI. It sounds like that's what you found. It sounds like what wasn't known. We kind of know what's going on in the hospital, but we didn't know what was going on out. What are these studies found? And you did a meta-analysis. So does everybody know what a meta-analysis is? Almost everybody. You want to explain what you did?
First of all, I used I searched the papers,
The literature.
Literature review to talk about the interventions about in community setting to prevent dementia for MCI people. And then I have the inclusion criteria and exclusion criteria. Okay. And from thousands of papers, at last I got the 14 papers to this topic.
How many did you start with? How many papers did you have to look at to get to 14?
I think.
Do you remember?
Thousands of, 1,400.
So you hear that? For those of you who haven't done a meta-analysis, right?
Just.
Did you read every paper, 1,400
first
papers?
Title.
Just the title?
First
Okay.
title and then abstract.
Okay.
Yeah.
Got
it. If the paper's topic is very relevant to my topic,
yeah.
I will download the full text to look.
Lovely. So those of you who are new to thinking about kind of meta-analysis, systematic review, that's what you do. It's a lot of work.
Yeah.
But you're not reading 1,400 papers from cover to cover, right?
No.
Nobody has the time for that. Maybe AI can do that for us eventually. Put them all into something, and it's like, here's the 14 papers.
Yeah.
Not yet. It's coming, I'm sure. But right now, it's a lot of labor. So, okay. And so that's what this meta-analysis is saying. Look at all the studies out there. And then you have certain inclusion and exclusion criteria about what you're most interested in and what's included. And usually, like observational study, maybe not included. You're looking for more rigorous trials to include in there. And it depends upon what you're studying. There may be some, there may be hundreds or thousands of relevant papers. There's a lot of stuff out there in the literature. You know, a lot of it's not all that great, so you have to sift through. Okay.
Yeah.
Thank you.
Thank
So
you.
that's a
Thank
little side lesson on meta-analyses. So I think, I mean, it feels to me like you could write that introduction right now. You've already done it. Okay. And you're still thinking now you're having a little trouble with what's not known? Was that the question? Because it's like, what's the problem, what's known, what's not known?
For this paper, I think the most important, the most hard part for me is discussion part.
Oh, yes, always.
Yeah, so that part I still need to work on it.
Yeah.
But for my proposal PhD program,
Yeah.
I think because our professor always asks us, what's the gap? So
That's right.
yeah, every time we rethink about our gap, we may have some hesitation. If this is the real gap? So sometimes we need to think back to have literature review again to see what's happened in the nowadays. Is this gap still
I
exist?
suppose, yeah. I hope you don't have to go back and look again because you've already spent all this time pulling the papers and doing the analysis. But I think you have it in your head. But how do you frame it in the discussion so that you're convincing the editor, the reviewers, that this matters? Because in the end, as a journal editor, I'm like, yeah, kind of interesting, but I don't really, but who cares? Not going to change anything. Not going to change how we think about the problem. Not going to change what we do about the problem. So, not for us. And I'll show you in a moment. There are 3 questions you want to ask yourself. And you want to ask yourself before you even before you do the research, but certainly when you're submitting, because this is what almost all journal editors, no matter what the journal is, certainly will ask themselves. Is it new? So is this new research? Is it true? That is, are the methods sound? Can we believe the results? And then the third is like, does it matter, or why should I care? Or why would our readers care? That's the discussion piece. That's when you kind of make your closing argument. This is what we did. This is how we did it. This is what we found. And this is why it matters. And the why it matters, sometimes it's hard. It is hard. But you had better know why it matters because you just spent like a year of your life working on it.
About her question, I would like to suggest some points for the introduction. For the meta-analysis, it's quite interesting for the controversial issue. So for the introduction, maybe you point out many intervention methods. And you can give the 2 references with a high impact factor and the famous journal. They're talking about the association, not association. So you point out the controversial issue there. So that's a meta-analysis. You can have an introduction for this one.
Thank you. So here's a gift. Some feedback right here in real time. Okay. Yeah.
Okay.
Yeah.
So that's the meta-analysis. And you can do that because it's a huge work for you. A lot of intervention in the community. Yeah. So you just cite because it's a limited spaces for the introduction. So you just emphasize using the famous and the high impact factor. 1 or 2 randomized, they have a controversial outcome. So that's why I would like to do the meta-analysis and systematic review.
Yeah.
Okay. And by the way, I would like to share my PhD training. And for the writing improvement, doing the revise point by point, you can improve your writing skill.
Yeah.
So don't rely on your professor. Ask your professor, let you try first, doing the point by point. It's a very good exercise, and I improved my writing for the paper. because I should have say something to rebuttal the point. What kind of the point you can accept, and some point I don't agree, and you how to say. So as I just think my PhD training, that's very important. Don't rely on your professor, right? Ask your professor, let me do first, then you can revise.
Thank you. Wonderful points. And so this could be fun, right? Writing could be fun. We so often look at it as a drudgery, but it's a real challenge and it's fun. You're getting your ideas out there. So remember, and you did a meta-analysis, you can look, this is another really helpful website. It's the Equator Network. And when you're writing papers now, and most journals now require, if you're doing like a systematic review, you need to use, there's certain guidelines out there. Yeah, there's PRISMA. If you're doing a quality improvement study in the clinic, there's Squire, observational, etc. So you want to look at these guidelines and make sure that sometimes the journals require it, but it's always better to show that you understand what the guidelines are about how to report on different kinds of research methods, and you're referencing these methods and try to follow them. Okay, and there's other ones for qualitative research as well that are out there. But this is a really helpful place to go. You always need to make sure you mention the ethics. It's called different places, either the IRB or the CHR, but the review board at your university to make sure that you're meeting the ethical guidelines. A lot of the research we do, if you're not, with human subjects, it may be exempt or maybe an expedited review, but you need to mention that you went through the proper process. It needs to be in the method section, or the journal should just send the paper back to you and say, we need you to include this. So results should be really short. I mean, that's something I had to learn. If you have tables that describe your results, you don't need to write it all over again with words. You just want to write the key points, the main points, the highlights. Otherwise, your tables should speak for themselves. Okay, the table 1, of course, is always describing the study population. Okay, and then on from there. You never want to discuss the results in the results section. It's just straightforward, objective. It's not we found that men were 50%, and we think that's because blah. No, that's for later. Okay, that's in the discussion. All right, and we've been a lot of discussion about the discussion, because as a lot of the more senior people here are saying, this is a really hard part to write often, but really important piece to write, and it should be fun. You can be a little more creative here, okay? It's your opportunity to say, this is what we found in comparison to what others found. This is what's interesting. This is what was surprising. We didn't expect to find this result, and we're kind of speculating. We think this is why it came out this way. This is what are the limitations of what we found. You want to be honest about that as well, because the reviewers are going to see it. You might as well acknowledge it, right? And say, yes, these are the limitations. Often people will put limitations and strengths. This was a limitation, but really it was a strength. That's very transparent, but just that always needs to be in there as well. But here's where, what are your main findings and why they matter? How are these findings supported by the results? How are these findings consistent with, supported by, or in conflict with other research? And here's where you can mention what some other folks have found. Sometimes it's confusing. Does it go in the discussion or does it go in the introduction? And you have to just kind of decide, get some feedback, try to figure out whether other results are framing like, this is what isn't known, like other people have found this, but they haven't answered this question, and that's why we did the research, versus this is what we found, this is what other people have found, and it's different, and we think what we found is different because of blah, blah, blah. But sometimes I will move something from discussion to introduction or back and forth. Sometimes a little bit arbitrary. That may be too much in the weeds for you guys who haven't written. And then the implications is so important. What are the implications, depending upon what the journal is and who your audience is, for clinical care, policy, education, or even other research in the area? Okay, but you have to say, why should we care? Why should the journal care? Why should the reviewers care? Why should the readers care? You put all this work in it, and you don't want somebody to say, yeah. We have an expression in English, meh. That's not good. You don't want the reviewer or the editor to go meh. Okay. So that's the same paper that we had written. So this is, I think, our first paragraph in our discussion. This study describes the early experience of a large health practice with an innovative program using e-consults from primary care to psychiatry for management of mental health problems. We found that psychiatry e-consults were a feasible way to support PCPs in managing complex psychiatric issues in the primary care setting, with PCPs as primary care physician, with PCPs using the service and frequently blah, blah, blah. So we don't say here why it matters, but we just kind of summarize in 2 sentences what we did and what we found. Okay, so those are the 4 parts. Easy, right? Those are the 4 parts of a paper. Easy. You have now your outline. All you need to do is do the writing. You actually have to do the research first. That's the fun part. It's all fun. So what are some common problems? We're almost done. Abstracts that are unclear. Redundant introduction discussion, like I said. Sometimes it's hard to sort that out. Sometimes you just have to write both and then go back and cut down. Don't worry about that. Tables that are hard to read. Redundant results. Just bad writing. Long sentences. Paragraphs that are too long or too short. Needless complexity. Remember, you're telling a story. You're telling a story in your research paper. You know, make it interesting, but make it short, sweet, to the point. So I was going to take a break. Maybe we'll do this tomorrow. So what I wanted to do now was go through kind of the submitting your paper. How do you decide what do journal editors look for? Some tips. There's actually, any of you use something called Jane, Jane? Easy for me to remember because it's my wife's name. It's like it's a lovely way of trying to match what you've done with the appropriate journal. So, and you can look it up now. You just put Jane into Google, and you can put your title in, you can put your abstract in, you could put keywords in, and it'll spit out a list of 15, 20 journals with relevance. Sometimes it gets it completely wrong, but almost always it gives me a few new ideas, particularly if I've tried submitting the paper and it got rejected, and I submitted it somewhere else and it got rejected again, and I'm feeling discouraged. Like there's got to be a journal out there that wants my paper. And then I realized, oh, there is this journal of like exactly what I actually studied. And I'd never heard of it, and I look at it and go, oh, it's got a decent impact factor. It's got the right audience. I'll give that a try. So usually your mentor will also really be able to help you if you're new at this. You know. Okay, so that's what we're going to do. Yeah, which journal? What is impact factor? All this stuff. Great. So this was supposed to be halfway through today. But we've gone much more slowly, which I think is totally appropriate to where you all are at. And I love your example. Thank you for bringing it up. It's just super helpful. So for those of you, don't be shy. If you're working on something, now's also an opportunity to get feedback, not just from me, but from the other professors in the room. You know, just instant little tip. So even if you just have an idea or you know, please bring it up. It makes it so much more helpful for you as well. So any final questions or comments or thoughts? Okay, well, thank you very much for your attention today. This morning, I guess. We'll see. I'll see you this. I've been doing a morning and then the next day. I forgot. I'll see you this afternoon. Okay. All right. I'll see you later. Thank you.